Well, okay, let's move on to your next, great story from this last week, which is healthcare for graduate employees. But before we can get in there, kind of once again, like this, we're really focusing on some of the less seen roles within the university this week. These are not grad students, grad employees, which I think is a distinction people mix up all the time. Explain, what's the difference between when you think about someone getting a master's and someone who's like a grad employee? What is this group of people that are protesting?
Right. So, graduate employees are essentially a smaller subset of graduate students, right? Mm-hmm. People who are pursuing that, education past an undergraduate education. A lot of these times they're employed in classrooms as teaching assistants or within labs as research assistants. And so these are people who are pursuing an education, but also, frankly, trying to earn some money on the side.
I see. So they're both studying at MSU and employed by the MSU, whether they're doing research or, teaching undergrads as TAs.
Exactly.
I see. And so you went last week to a protest that they held, talking about, some of their healthcare benefits. And before we get to kind of the demands and the issues, right now you're a grad employee at MSU. What is the current healthcare coverage?
If you're a current grad employee at MSU, you're getting coverage through Olan Health Center, right? Which is probably what a lot of undergraduates are familiar with. But what they're saying is that healthcare provided through Olan is simply not sufficient to meet their needs.
Yeah, and so Olan, for those who aren't undergrads at MSU, it's like it's on campus, it's a clinic, and you can go and through the university kind of get healthcare, but it's pretty limited, the services that they offer. And that's exclusively where grad employees are covered. Is that Olan?
Yeah. And so I spoke with the president of the union, and she essentially told me, Olan is great if you're an undergraduate student, you've got a cold, or you've got the flu.
Yeah.
But if you're a graduate employee, you might be within 20 years old or 50 years old, and you've got a lot more complicated health issues. And Olan is simply not prepared to deal with those issues.
And so what are they asking for instead from the university?
They're asking for a couple of things. One is simply for an alternative healthcare provider, one that isn't Olan, that allows them to get that care that they need.
So they can go to, just a regular doctor's office or a hospital or something that's not necessarily like this campus student clinic.
Exactly.
Yeah.
And as well, they're also just asking for dental and vision care. I spoke to one graduate employee who said that because of the cost, because at the time, MSU's healthcare policy did not cover dental.
Yeah.
And when he found out that he had an issue with his teeth, he had to wait much longer than he would have been able to, and he ended up losing one of his teeth because of it. And so that this healthcare policy really does have impacts on people's lives.
Yeah, and so they're on campus, they're protesting, but also they kind of put together a formal proposal. It sounds like tell us what are they? They put this proposal forward. Have they gotten a response? Where is that at?
Yeah, so they gave this proposal to, again, MSU Human Resources. And as of right now, I don't think that they've heard anything from them. But again, that's the formal version. The demands are mostly the same.
I see. Yeah. Well, I'm sure you'll be sure to stick with it and have to come back on the show if something develops.